Good morning, everybody. This is the week of antimicrobial resistance. Our theme is to raise the awareness and stop the spread of AMR, antimicrobial resistance. So my topic is to highlight the importance of infection control to combat antimicrobial resistance. I'm Dr. Bhagya Siri, consultant microbiologist of Teaching Hospital, Karapiti. So you all know what is antibiotic resistance. When a bug, bacteria, or any microbe, when develops resistance to antimicrobials, it's called antimicrobial resistance. What are the causes? Overprescribing of antibiotics and patients not taking antibiotics as prescribed, or unnecessary antibiotics used in agriculture, fisheries, or as growth promoters like, and their gut microbiome develops resistance to these antimicrobials. The most important thing is poor infection control in hospitals and clinics, and also poor hygiene and sanitation practices, which can give rise to spread of antimicrobial resistance. And also lack of rapid laboratory tests, which fails to differentiate. So we can't differentiate between viral and bacterial diseases. So most of the viral diseases will get unnecessary antibiotics and emergence of antimicrobial resistance occur. What is the gravity of this AMR? The huge global impact of antimicrobial resistance on human health and economy is there. Approximately 700,000 AMR-related deaths per year globally happen. And only 30% of developing countries have a national action plan on AMR. And there will be $100 trillion lost to the world economy due to AMR. 58,000 newborns will die yearly because of drug resistance. And 490,000 cases of new cases of multi-drug resistant TB happening every year. So likewise, it's a huge impact on the human health and also on the global economy. We all know sepsis by multi-drug resistant organisms are extremely difficult to treat, very costly, and definitive antibiotics are difficult to find, and also availability is not always, not continuous. And their adverse reactions and toxicity are very high. And when the patients are in the hospital for a long time, they will be prone to get more and more secondary infections, nosocomial infections, and more high rates of antimicrobial resistance will happen. Also, there is a component of immunosuppression due to continuous drugs and longer hospital stay, which will predispose to more MDR infections. And there will be huge family issues and economic loss to the country. So how can infection prevention and control help in combating AMR? One thing is it reduces the colonization by resistant organisms. Secondly, it prevents occurrence of multi-drug resistant infections. And thirdly, it prevents spread of multi-drug resistant infections. But how? One thing is surveillance of multi-drug resistant occurrence or hospital-acquired infections. And the infection control helps us to make policies on hand hygiene, aseptic procedures, decolonization, isolation, sterilization and disinfection, cleaning and waste management. And also the infection control helps us to review these policies, update these policies, and also to monitor the compliance, monitor the adherence to these policies. And like I said, the surveillance helps us to predict the outbreaks and to detect outbreaks early and outbreak investigations and control later. Then continuous education and raising awareness are also helpful. So what is important in our routine practice in the hospital? One thing is hand hygiene and our standard personal protective equipment. And also you need to practice aseptic procedures in blood drawing, catheterization, wound management, and all that procedure. You have to have a good surveillance in your practice and also a good infection control network and frequent audits to detect mistakes and gaps in communication. You have to have a good follow-up of patients with multi-drug resistant infections and refer them to the tertiary care facilities from other facilities if necessary. And then decolonization like in MRSA, and also education on personal hygiene and hand hygiene. So what is hand hygiene? It's the most effective way of preventing spread of infections, especially the healthcare associated infections. This figure shows your hand imprint on the blood agar plate. So on the hand imprint, all the bugs on the hand have grown. Here you can see most of the time the staphylococcus and strep. So if you are not practicing your hand hygiene properly, you will be transmitting all these bugs, all these bacteria from patient to patient, from person to person, even among your household people. So this illustration came from the WHO book on hand hygiene. You can see how a healthcare worker can transmit bacteria from one patient to other patient if you are not practicing hand hygiene. And most of the time, the instrument and the surfaces are colonized with bacteria. And if you touch them and without hand hygiene, if you touch the patient, then you will be transmitting all that bacteria and fungi to the patient. And most of the time, these surface bugs are very much antimicrobial resistant bugs. So hand hygiene, for you to have effective hand hygiene, you need to fulfill several things. One is when to do. This is decided by the 5 moments recommended by the WHO World Health Organization. What are these 5 moments? 2 befores and 3 after. 2 befores, before patient contact and before aseptic procedures. 3 after patient contact, after exposure to blood products, blood and body fluids, and after touching patients around. All that 5 moments, you need to practice your hand hygiene. How to do? Decided by the 6 steps. Palm on palm, back of the palms, interlace fingers, cup fingers, and your fingertips and your thumb. If you want, you can include the seventh step like wrist. Then with what? Alcohol or soap and water. If the touching is a brief thing, or if your hands are not visibly soiled, you can practice the alcohol hand rub. But before invasive procedures, and also if your hands are visibly soiled, and after touching the patients with antibiotic-induced diarrhea, you need to wash your hands with soap and water. There's no any excuse. You have to have your soap and water washing. How long? With alcohol, because of the killing power, you can limit your hand hygiene for 20 seconds. But with soap and water, the WHO recommendation is to have 40 to 60 seconds of hand hygiene. But for practical purposes, we say at least you need to wash your hands for 30 seconds. Hand hygiene after hand washing with soap and water is very, very important. And what about gloves? Can they replace hand hygiene? Absolutely not, because they can have micro tears or micro pores. So the secretions and excretions can transmit here and there through the pores, carrying bugs. So you need to wash your hands before donning gloves and after removal of gloves. Standard PPE. Standard PPE, the personal protective equipment, The minimum PP required in this pandemic, COVID pandemic, will be masks, gloves, shield, gown or apron. Why are these important? Because you must be healthy for you to avoid drugs. That's why your personal protection is important. Is it all right to go bare hands in between patients in the routine care? Yes, of course. If you are practicing your hand hygiene properly, you can go bare hands. Actually, I am doing that. I don't wear gloves in between patients. In the high-risk setup, is it okay to do hand hygiene over the gloves? Well, it's not really recommended, but you can try if your hands are not visibly soiled, if your gloves are not visibly soiled. The best practice is to change your gloves in between patients. Right. What are these aseptic procedures? Proper skin antisepsis, sterile procedures, and hand hygiene are very much important in blood drawing, cannulation, catheterization, and wound management like surgery, incision and drainage, or dressing the wounds. How to do this aseptic technique? In the blood drawing or cannulation, the entry site must be properly cleaned. How to clean? Clean with alcohol over and round the selected site and allow to dry. You have to wait at least 30 seconds for it to get dry. And then clean with 10% povidone iodine in a concentric fashion from the center to periphery. Allow at least 1 minute to act, because how much good is the antiseptic? You need to give time to the antiseptic to kill the bugs at the site. Otherwise, you will be contaminating your sample, or else you will be introducing organisms to the site, leading to subsequent phlebitis, cannula site infection, and all that unnecessary infections, leading to more and more use of antibiotics and emergence of antimicrobial resistance. Right. Surveillance. Surveillance is an important part in infection control. Helps to identify early outbreaks and the source of the outbreaks. And also, by doing that, it helps in preventing misuse of antibiotics. You can have a lot of things in the surveillance. Nosocomial infections like surgical site infections, bloodstream infections, catheter-related urinary tract infections, hospital-acquired pneumonia or ventilator-associated pneumonia, line or device infections, rate of multi-drug resistant organisms, exposure injuries like occupational injuries and notifiable diseases, any emerging infection, and antibiotic use. All these data are very much important for us to streamline our practice, and thereby we know our figures and we can correct our mistakes and we can minimize the unnecessary antibiotic use. The infection control network is really important in any hospital, in any healthcare setting. You can have a very good infection control network with the daily ward rounds by the infection control team, on-site advice, MRSA screening and decolonization, waste management, cleaning assessment, surveillance of nosocomial infections and MDR pathogens, management of accidental exposure injuries, surveillance of new hepatitis B, C, HIV, and family screening, surveillance of influenza, notification of infectious diseases, and advice on vaccination. All these things can be done at the wards or on site when the infection control networks are in practice in the hospital. So by having the proper advice, actually, a lot of problems can be avoided. And taking care of patients, very important. Following up of patients with recurrent MDR infections, example, recurrent UTI, urinary tract infections, or skin abscesses. You have to look for the source and nature of the infection. And cultures should be sent to identify the bug. Then only you can target the antibiotic to kill the particular bug, and also proper treatment. In MRSA carrier status, in recurrent staphylococcus infections, you need to screen the patient for MRSA carrier status. If the MRSA carrier status is there, you need to decolonize the patient. And if necessary, you have to refer the patients, such patients, to the tertiary care facilities from other facilities. And education on personal hygiene and also precautions to avoid spread within the household is very, very important. Especially in community-acquired MRSA, you need to advise on avoiding the sharing of personal items like towels, combs, right, soap, and the personal other items. Bed linen, you have to avoid sharing because it can transmit the infection from one person to other. How to do MRSA decolonization? This can be done for the infected patients and for the patients awaiting major operational procedures. Duration of regime is for 5 days only. If decolonization fails in pre-op patients, you have to refer to the microbiologist. You have to do both nasal and skin carriage of skin decolonization. How to do nasal decolonization? You have to apply mupirocin, 2% nasal ointment to the inner surface of anterior nares 2 to 3 times per day. A match hit portion to be applied to each nostril using a disposable cotton swab. And patient should be able to taste mupirocin at the back of the throat after application. This should be done for 5 days consecutively. How to do skin decolonization? Daily baths with 4% chlorhexidine solution can be done. Daily baths, you apply the antiseptic and you wash it off. And pay special attention to non-carriage sites like axillae, groin, and perineum. And every other day, on first day, third day, and fifth day, you need to wash your hair with 4% chlorhexidine and wash it off with normal shampoo and rinse off. So finally, you have to have a good practice in your healthcare facility with infection control. So there should be written protocols for all the procedures and hygiene, aseptic procedures, cannulation, catheterization, wound dressing, decolonization, sterilization, disinfection, isolation, all that things you have to have written protocols. And you need to have frequent audits to see whether the people are doing it correctly. And hand hygiene facilities should be there. Alcohol hand rub and also soap and water. Proper sterilization and disinfection procedures should be there. And spill management. Blood, vomitus, stool, urine, spill management should be done properly because the people should be healthy to avoid unnecessary drugs. And cleaning. The instrument cleaning and also the environmental cleaning is very, very important to reduce the surface microbial loads. And good housekeeping, documentation, and also the regularization. So those are the things which which are needed by you to practice in your setting.